We work with IBCLCs, we work with SLPs. I can assess a patient's latch at the bottle or at mom's breast and say that's good, that's not good, but we still co-manage our cases with a lactation consultant because our patients need more co-management. Hi, it's Dr. Ludeman from Bolingbrook Family Chiropractic. Today I am answering some questions on our Instagram Reels and our YouTube Shorts. So we got a question from Karina R, and she was saying, my pediatrician said her latch looks fine, but it still hurts. Should I be worried? So not to bash other professions, because I saw a reel somewhere that said, don't see a provider if they bash other professions because that's a red flag. There are lots of different providers that are going to be involved in your child's care, and a pediatrician has a purpose and they have a place. If your pediatrician is trained as an IBCLC, if they're trained as a myofunctional therapist, they've done additional training to understand kids and motor patterns and how to be at the breast, then yes, your pediatrician is qualified to say, yes, her latch looks fine. But if your pediatrician is like most pediatricians in our area, they haven't taken these additional courses. We do have a couple OBs or pediatricians that are lactation consultants. Those providers are better equipped to answer these questions. But if your pediatrician is just in office all day and their purpose is to make sure that your kids are hitting milestones and then diagnose diseases, they're not really qualified to assess latch. This is why it's important that you establish yourself with a IBCLC or a pediatric chiropractor that has training in lactation, or a pediatric chiropractor that has additional training in myofunctional therapy, or this is why you establish yourself with a myofunctional therapist or a speech therapist, because those are the people that are able to actually do an assessment on their latch and tell you if their latch looks good or if their latch doesn't. Personally, in our office, we work with IBCLCs, we work with SLPs. I can assess a patient's latch at the bottle or at mom's breast and say that's good, that's not good, but we still co-manage our cases with a lactation consultant because our patients need more co-management. So if you feel like in your mom gut that the latch is not good, if it hurts, if it doesn't look right or something's off, you need to seek care and see a board certified lactation consultant, or find another provider in your area like a pediatric chiropractor or a SLP that's trained in myofunctional therapy, or an SLP that is a lactation consultant, to make sure that you have a solid assessment. So again, not to bash other providers, but if they don't have the additional training, they're not necessarily qualified to be making that diagnosis, even though they have MD behind their name.